So that's why we're going to remove the buccal fat here. I think I'm going to reduce it. Yeah, it's a bit bulky here. Looking for any volume here, like the gland. Surprisingly, not that much. This is a traditional entry point for the deep plane, but I usually modify it to make it even shorter. So we usually traditionally enter the deep plane in this line, which is between the gonial angle and the canthus. In order to minimize the subcutaneous dissection, we actually do something called sailboat modification, where we actually keep more skin with this mass attached to each other, so we can have minimal skin naked dissection, which will produce a better healing. This part here will move into the actual ear. I usually start with the eyebrow lift. Due to the patient hair loss pattern, I modified my incision to an incision around the midline area and one in the temple. I make very tiny superficial incision, and then you can see how I spread around the hair follicle to minimize any hair loss in the area. So the way this operation works is by releasing all the attachment right directly on the bone. It looks painful to watch, but it actually very non-traumatic on the body. We release all those attachments on the bone and the muscle fascia all the way back to the back of the sculpt, and in the front into the attachment of the eyebrow, and we reset the sculpt backward to allow the heavy load on the eyebrow to be released. And then we fix the galea fascia into the bone tunnel to allow the new location for the eyebrow. So the purpose of this part of the operation is to decrease the hooding of the eyebrow and the forehead on the eyes, which will give a more youthful and natural look. I go to the central neck, I make tiny incision. I also spread the skin so we will not interrupt the hair follicle in the chin to not produce baldness in the area. And then I access the platysma muscle and I decrease the volume underneath the platysma, mainly lateral. We do not want to decrease the volume centrally so we will not cause a Cooper neck. So I remove some gland, and in this case we have some gland and some fat in the lateral compartment. I start with the upper eyelid and I inject the local anesthetic and the tumescent directly underneath the skin to cause some form of hydrodissection. I'm a muscle preserver, so I preserve the pink orbicularis muscle. And then we sew the skin with permanent sutures.
Okay, why don't you finish this then?
Now the lateral portion of the face and the neck, where we go into the subcutaneous plane, minimal subcutaneous dissection. And then immediately we dive into the deep plane. You see I'm elevating the deep plane, and we go into the subplatysmal subsmass plane. We elevated it bluntly, as you see here, and then we keep the skin attached to the smass and attached to the platysma, which is additional modification of the technique that further improve the healing process and the shape of the face and the neck.
He needed it, he had some fullness, yeah?
Wow.
He needed it, yeah.
So this patient had like a protrusion in the buccal fat in the anterior cheek, and doing the facelift sometimes not enough to correct that. So sometimes the buccal fat herniate and cause jowling. So in his case, patient wants more like a chiseled look in the face. So we have the buccal fat here, which is here, easily herniated. I'm not going to remove all of it. I'm going to remove the bulk of it, and it's easily removed in this technique here. Just going to dissect it off this line. You just
And once we release all the tension from the smass and the skin, we start suspending the deep plane into the appropriate location. And I tailor this, as you see, with multiple permanent sutures and make sure there's no tension. There's no tension on the lift. If there is tension, then the lift will fail. So we are tailoring about 70 or 80 degree lift, so it's a vertical lift. You can see here how the jawline has been slowly getting defined, and the skin has been mobilized laterally, so there's no more naked skin. Everything has been mobilized as a composite flap, which will give a more healthier, natural look. Here in the mid-face, we use very small suture here, and this is enough suture to lift the mid-face. We go to the neck and we suspend platysma muscle into the mastoid bone deep into the groove to provide a depth between the neck and also the jawline. A suture that will suspend and lift the platysma muscle into the mastoid bone. And this is the most important suture in the whole case, which will produce the nice shape of the neck. I zigzag the area around the temple so to produce a natural look. The scar would be minimal to non-existent because we are using no tension technique. Now we are processing the buccal fat that we're going to use to inject it underneath the eye. So it was a great advantage because this buccal fat is one of the best fat that we can use.
That is really good.
Once we finish all of that, then we can trim the skin without any form of tension. We also further improve the scar later by doing some lasers, and around week 3, week 4, week 6. But even we don't laser anything, the scar would be minimal to non-existent because we are using no tension technique. And this will complete our procedure today.